February is National Senior Independence Month, a time to celebrate the freedom, dignity, and choice that comes with aging on your own terms. But independence in retirement doesn't happen by accident. As we live longer, staying independent increasingly depends on how well we plan, not just for today, but for the decades ahead. Today on Next Chapter Living, our host, Steven Sabo, will talk about what independence really means in retirement and why preparing for long-term care may be one of the most important steps to protecting your lifestyle and your peace of mind. Steven is a financial advisor with Executive Financial Group. To learn more or get personalized guidance, you can visit executivefinancialgroup.com. Steven, so good to see you.
It's really great to see you too, Alyssa. How are you doing today?
I am doing well. We joked before we started recording that I had to do some digging to find that February was National Senior Independence Month.
Yes.
It's not readily available on any calendar.
Yeah, they aren't throwing that one out there at us, huh?
There are no cards. I looked in the card app.
Yeah, it seems like they're adding something every single month or every single day. There's a new National Awareness Day of something. So
yes, there's
this
Dog Day, Cat Day.
Yes,
everything.
Pizza, donuts, I don't know, whatever you want. Choose one and it's out there.
Exactly. Well, this one, even if it's hard to find, is something that is so important, especially when people are thinking about retirement planning, because I think we all want this idea of retirement being our happy place. We have worked hard. We've put in our years of working at a job, and now we want retirement to be whatever that dream individually looks like, whether it's sitting on the couch with the grandkids or traveling the world. Everybody has their idea of what it looks like, but without planning, that independence can become an issue.
Yeah, absolutely. And, it's one of those things, too, where, retirement is something to look forward to and to enjoy and to make sure that you have, some things going on that you can really enjoy yourself in. And unfortunately, healthcare and long-term care is such a big part of it. And people worry so much about it. And it's unfortunate because there are so many tools and resources out there nowadays for people to be able to get ahead of that. And like you said, it just takes a little bit of planning with somebody like myself, in order to kind of get in front of that and make sure that you are going to be taken care of and that you are covered so that you can enjoy yourself, right? You've worked, like you said, you've worked so hard. You're looking forward to all these things. And the last thing that you want to have to deal with is, oh my gosh, how am I going to come up with all this money in order to take care of either myself or a loved one if something were to happen to you? And so, it's really important to get out ahead of that and make sure that, that you're covered and that you're protected, and you have a plan for if you ever have to, go into a facility or maybe have somebody into your house for long-term care. It looks a lot different today than it used to, but there's still, that possibility that you may need care. So it's important to plan for it.
And people are living 20 to 30 years in retirement.
Oh, yeah.
It's not the same as when, my grandmother retired and you're hoping that you get another 12 years after you,
right.
Finish working. People are living into their 90s. It's a full chapter at this point.
Absolutely. I mean, it's definitely a big chapter. And, one of the things that we like to focus on, or whenever we meet with a client and we're coming up with a plan for them is, we want to look at the longevity of their family. Mm-hmm. How long have your parents lived? How long have your spouse's parents lived? Because that's going to become really important when we plan for, what are we going to do? Do you have enough money to live to 95 years old if you're retiring at 65? That's 30 years. That's a long time. And so it can be scary and it can be a daunting task for people to have to look at those things, but again, it all comes back to just a little bit of upfront planning to make sure that you have everything covered.
And we have a lot more variety now, to your point. It's not just either I live at home or I live in a nursing home or some sort of facility.
That's right.
There are things like having at-home aides come help, but that requires planning and the financial means to cover that.
Yes, that's right. Yeah, there are, a lot of people think of, when you get older, you're going to end up being sent to a home and it's so expensive and costly and it's the end of the world and everything like that. But, we're seeing a variety of different situations these days. Like you said, at-home healthcare, family members coming to help. There's a lot of things and we sit down and we want to plan it all out for you and make sure, ideally most people want to stay at home with their loved ones as long as they can. And I get it. Nobody likes to be in a home where they feel like they don't have any control or, they don't have their personal belongings. And, so if you can do that, it's really nice. And we try to, work with our clients to make sure that, if you can, if that is available to you, that we'd love that for you because, it just makes things so much more comfortable in retirement. I certainly know that whenever I become that age, if I'm going to be in need of some help, that I'd love to be at my own house with my family surrounding me or helping me or having somebody come in to help me. I joke all the time. I say, hey, once I get to a certain point, stick me out in the woods and let me go. And but it's something that's on a lot of people's minds. And, it's very important to plan for it.
One of the statistics that I think is most shocking is that 70% of people turning 65 and older will need some sort of long-term care during their lifetime. And I know, at least from my own experience with my mom when she was sick, the big thing that she kept saying was, I don't want to be a burden. I don't want to be a burden, because she knew that I was an only child. And so her care fell on me when she was sick. And, thankfully my husband stepped up and helped, but we were still juggling our own lives and work and 2 kids of our own. Talk to me about what some of the options are out there for people who have that same mentality. I want to be independent, but I don't want to be a burden to my family.
Yeah, I guess that's kind of the parently way, if you will. They've been taking care of you all their lives, and even into their older age, they still don't want to be a burden on people. And, there are a lot of options these days. Like you said, there's at-home health care. You can have nurses or certain caretakers come in every day of the week, a few times of the week. It just depends on the level of care that you need. But there are a lot of options out there as far as, having people come to your house or there are services that even pick people up nowadays that take them to doctor's appointments and doing those things. Because, at the same time, a lot of these people that are in that situation, their kids are working. They do have other obligations that they need to tend to. And so it becomes difficult, like you said, the parent doesn't want to be a burden, but the child doesn't want to feel like they're neglecting their parents. So it can be difficult, but we have clients that we explore all kinds of options with. Some people, for instance, we had a set of clients that the wife, she had to go into a home, and it was an assisted living facility. So it wasn't full skilled care or anything like that. And it was right down the road from their house. And so he was able to stay at home. She was there. They were able to frequently get together. Another client, same facility, they actually had apartments that you could buy through them so that you could have the other spouse living, but then the nurses were easily able to come over and kind of help at the apartment that's in the facility. So they still had some independence, if you will, but it was right there for them. And then, we have other clients that they have people coming in frequently, sometimes once a day, sometimes a couple times a week. And it really just depends on the level of care that you need. Sometimes we see people that go into a home and they may be there for a couple of months before they end up passing. And, other times we've had people that have been in there for years and years. And so it becomes difficult because the price is expensive. And, it can kind of get overwhelming having to be in there that long. I know it takes a drain on them mentally. So.
Some staggering statistics in terms of cost, just to put it out there for those that don't know. The average assisted living is anywhere from $66,000 to $71,000 a year. And a nursing home with a private room is upward of $127,000 per year, just based on national averages. I think one of the things that people often overlook is that Medicare does not cover long-term care. And I think some families are unfortunately surprised about that. Would you talk on that a little bit?
Yeah, I think people kind of have this feeling that Medicare, once you reach that certain age and you begin to use Medicare, that it's kind of just overarching. It's going to protect you from everything. And unfortunately, like most things our government does, they don't really cover you as well as as well as you would think that they would, especially with how much you've paid in and taxes over the years and everything like that. But yeah, unfortunately, Medicare does not usually cover long-term care, and it can be quite burdensome on a family. Either they have to start to self-pay and spend down a lot of their money. Now, there are certain caveats and rules that allow a spouse to keep certain things, a house, certain amounts of money. There are ways to kind of protect that, but it can be pretty costly. And if you don't come up with a plan, up front, a lot of people want to remove all their assets, right, from them and maybe put them in a trust or do something like that. But, unfortunately, I think a lot of people are misled with how those work as well, that they don't necessarily protect you in the way that you believe that they do. And so, again, it becomes this careful game of trying to time things correctly. A lot of people, for instance, we had a client, her husband got sick pretty quickly after retirement, and it all set in very quickly. And he was going downhill, and he was going to have care, and they were panicking. And then the kids, started to say, well, why didn't we do this? Or why didn't you provide that? And we said, hey, look, it's not as easy as just saying, well, why didn't we go back and do these things? It's difficult to plan for that. But we had a plan in place, and we said, hey, look, you're protected from these things. You can self-pay, and then we can start to do some things and, kind of shift assets around, if you will. And luckily in their case, he wasn't in there that long, so it didn't, affect them. But, Medicare isn't going to cover it. And so you have to have a plan in place. Now you can go, I guess you could say, poor on paper and have Medicaid start to pay for things. But Medicaid is a welfare program. So at the end of the day, they get to pick and choose a lot of how things work. And so, if you want a certain facility and they're the ones that get to pick it or choose it, they might say, hey, well, we have an open Medicaid bed here, and this is where you have to go. And so, you want to make sure that you're not relying on those completely. Because at the end of the day, you want your family members to be comfortable. You want them to be close. You want to be able to go see them. And you don't want the state or whoever, the federal government, to kind of be taking over that and saying, hey, this is how it's going to have to work for you guys because you're relying on us for it. And so, there are a lot of things out there today that can provide long-term care benefits without maybe exhausting all of your assets. And, it's a deeper conversation that we could get into one-on-one, but things have come a long way in order to help people with that. So,
and I think people have a misconception. Older long-term care plans used to be, you put it in. If you don't use it, you lose it. There are options out there now that you can have that set aside for long-term care, but then there are fallbacks. If you don't end up needing it for long-term care, you can still have access to that money for other things or pass it along to your heirs.
Absolutely. There are tons of, and I think that unfortunately over the years, that space has kind of been, I don't want to say corrupted, but, there are people out there and at the end of the day, it's their job. They're out there selling certain things. But, the way that we look at it is we use certain products and services for their intended reason. We aren't just selling them because we want people to buy something, and unfortunately, like you said, original, the old school long-term care, you spent all that money. And if you didn't use it, you lost it. And a perfect example is we were just looking at a certain type of insurance policy for people that provides long-term care benefits. They pay in so much and it provides a specific amount of long-term care benefits, and it can be used in a multitude of different ways. It doesn't have to be just for a home or anything like that. It could be home health care. And the great part about it is you pay in all this money, and at the end of it, if you don't use it, you're going to get something back. And in the cases that we just ran for some people, they're actually going to get back more than what they paid into it, which is not always the case. And that just depends on your age and certain things like that. They were actually going to get back a little bit more than what they paid into it, or their heirs might get back a little bit more. So, in terms of long-term care, those are great options because people traditionally think of long-term care and you say, gosh, I might spend $250,000 on this over a 10-year period and it's gone. To where now there are so many different options out there. And it's important to know how each of the different policies work and what they cover and what they do not cover, because you can still spend a lot of money on them. And then if you get into a situation where you go to use the benefits and they don't cover what you think, then you could be in trouble. So it's important to work with somebody and say, hey, look, what is out there today? But the landscape has changed. There are a lot of products and services out there. And it's important to make sure that you're working with somebody that knows the ins and outs of them.
Ideally, what's the age range that you like to have clients come in and start having this conversation with you?
Yeah. So, that changes a little bit for everybody depending on their circumstances. But the cases that I was just speaking on, these people are in their mid 50s. They're still working, and the plan is for them to work for, I don't know, another 7 to 10 years possibly. But I'd say anywhere in between that kind of 55 to 70 range. Once you start getting into a little bit older, it becomes more difficult or more expensive to purchase those benefits, right? Or you might not get as much out of them as you would starting earlier. So I'd say between that kind of 55 to 70 range is where we like to see. The earlier, the better, obviously. But once you start getting past that 70-year-old kind of range there, it becomes a little bit more difficult to plan for that. So that's typically when we like to start doing it.
Well, National Senior Independence Month reminds us that the best way to stay independent tomorrow is to start planning intentionally today.
That's
and
right.
A thoughtful retirement plan can help ensure longer lives come with greater confidence, flexibility, and peace of mind. If you're ready to write the next chapter in your story, you can schedule a complimentary consultation with Steven by visiting executivefinancialgroup.com. Again, executivefinancialgroup.com. You can also find them on YouTube and Facebook. And of course, be sure to subscribe wherever you listen so that you never miss an episode. Thanks for joining us.
The opinions expressed by Steven Sabo and guests on this podcast are their own and do not reflect the opinions of this podcast station. All statements and opinions expressed are based upon information considered reliable, although it should not be relied upon as such. Any statements or opinions are subject to change without notice. Investments involve risk and unless otherwise stated are not guaranteed. Past performance cannot be used as an indicator to determine future results. Any strategies mentioned may not be suitable for everyone. Information expressed does not take into account your specific situation or objectives and is not intended as recommendations appropriate for you. Before acting on any information mentioned, please consult with a qualified tax or investment advisor to determine if it is suitable for your specific situation. This program is designed to provide accurate and authoritative information with regard to subject covered. Investment advisory services offered through Virtue Capital Management, LLC, VCM, a registered investment advisor. VCM and Executive Financial Group are independent of each other. Pennsylvania Insurance License number 670429. Any guarantees mentioned are backed by the financial strength and claims paying ability of the issuing insurance company and may be subject to caps, restrictions, fees, and surrender charges as described in the annuity contract. Steven Sabo and/or Executive Financial Group are not affiliated with or endorsed by the Social Security Administration or any other government agency.